you'll see in a minute, I'm going to need you to be very quiet because I brought a special message for you from very far away, from all my colleagues. It was very important for them to say hello to you. So before I say any further, I'm just going to show you a little video. Sorry that it's a little tight here.
Fertility Centre here in Toronto, Canada. And I'm Dr. Clifford Liebrock. I'm the founder and the medical director of this clinic.
Hi, I'm Dr. Bratz, and I'm a staff physician here at the CReATe Fertility Centre in Toronto, Canada.
Hi, this is Dr. Karen Glass from CReATe Fertility Centre in Toronto, Canada. Hello, my name is Dr. Prati Sharma. I'm a reproductive endocrinologist at CReATe Fertility Centre in Toronto, Canada. I'd like to welcome all of you to our practice. CReATe Fertility Centre has a huge third-party reproduction program, and a large part of our population comes from the LGBT community.
We recently published one of the largest series looking at third-party reproduction in Canada. We are currently one of the largest centres in Canada involved in third-party reproduction.
We do over 1,200 cycles a year. We have many international and local donors of a variety of ethnicities and many local surrogates who are happy to assist couples like yourselves conceive and start a family. We are very comfortable, we are open, and we are friendly, and we welcome you to Canada.
The egg donor program is highly structured and personalized at the same time.
Both our donor egg and our surrogacy program have nurses assigned to the cases, so that once you're matched with an agency, a nurse will contact you via email and be your liaison, so you never feel lost, even if you're not here in Canada physically.
You can expect to first meet the doctor, and usually it's if you're remote from our clinic, we can do that by phone or Skype. And we can go through an extensive consultation to give you all of the different issues that are involved in surrogacy. We also have a counseling session that we can do by phone or Skype as well with our very experienced counselors.
In addition to being highly adept in performing IVF and having a large donor egg and surrogacy program, we offer a lot of adjuvants to IVF, as we know it's important for many couples and single people who are starting a family to have one healthy baby at a time.
One of the main advantages of the third-party reproduction program here at CReATe is our state-of-the-art lab facility. A big challenge in achieving a pregnancy is making sure not only that you get pregnant, but that you have a live, healthy, normal baby.
Not only do we have embryoscopes to help us pick the best embryo, but we are one of the only programs in Canada to have a PGS program. PGS is Pre-Implantation Genetic Screening. It enables us to biopsy your embryos and ensure that they are genetically normal. In this way, we are making the process completely efficient for you, putting in only normal embryos and increasing the chances of a live birth.
If you have embryos that are frozen at another clinic local to you, we can also have those embryos shipped to us, and we can provide the transfer of those embryos to your surrogate. So this is another way that we can work with you to build your family, in addition to having live donors and surrogates as well coming to our clinic for the provision of fertility services. I want to wish you the very best of luck in building your family, and we hope that we can be part of that process to care for you and help you achieve the family that you've always dreamed of having.
As a staff physician here at CReATe Fertility Centre, I feel we have an excellent program to support the LGBT community in starting their own family.
Our facility is not only a great place to make a baby, but it's a great place to be involved with and a great place to build your family.
We hope that you choose to come to Canada and come to meet us here at CReATe. We're a really friendly, warm environment. We have a great group of embryologists, nurses, doctors, ultrasound technicians, and we really want to help you have that family of your dreams.
Believe it or not, those are not actors, they're real. You're thinking it. So once again, I am Dr. Bratz. I'm one of the members of this clinic. And so I've met with a few of you over the last day or so. I'm just going to sit down. And to complement what Leah was saying and the Canadian surrogacy or fertility consultants, we take this very seriously. Canada has, for some reason, not been perceived as a big player. It's called the little brother of the United States. I don't think we're anyone's little brother. We're doing more cycles. Maybe we're the big brother. We're doing more cycles than any clinic in Canada currently. Our center. We are looking to branch out and assist pretty much any couple in terms of any specifics they may have. I do have some prepared talks. I think that they may not be as useful right now. I think what's more important is that we just share our passion for helping you on your journey. I also brought with us, we brought three members of our team. We actually are a 100-member facility. We are very involved in both clinical and research activities. Dr. Moskowskis is not only our head of andrology, a very active researcher, but he also can share his experience with egg donor and surrogacy. We'll have him chat a little bit at the end. But I think other than the obvious benefits of Canada, which we said medically safe, state-of-the-art, currently there's a financial benefit in terms of our weak dollar, but it's a benefit to you. I might want to open it up a little bit because it is a breakout session. If there's any questions you have at this moment, or we'll be at the booth later today, and if you do really want to meet with myself or with anyone from our team, I'm happy to set up sometime either later tonight or tomorrow morning. We're staying at the Hilton. Or as Dr. Liebrecht, my colleague, had mentioned, we're very active on phone consult and Skype, and that can easily be organized in the future. I feel that this meeting is an excellent stepping stone and sort of touch-off point. Some of you are actually actively in the process, some of you are still learning, but there may be nuances, there might be some specifics about your case that you may not want to share in a large group. I understand that. And so I think that very often people feel that they have to have their egg donor, they have to have their surrogate before the medical team will get involved. We actually don't look at it that way. We are happy to get involved at any level. As mentioned, we are very happy to help you transport embryos to our clinic because of the surrogacy milieu that we have in Canada. We are very happy to be your first consult. We are experts in this area. Currently, probably about 30% of my personal practice in fertility is with LGBT. And so we're doing a lot of this. I don't think it's a coincidence. It's definitely one of our passions. And we are also very active in community outreach. We're involved in the Pride Parade in Toronto, Canada. We do a lot of community work. We've produced a lot of literature. We actually have USB sticks we'd like each of you to take, one per couple, please. We don't have the video on there. I know you're excited for that video, but it will be on YouTube. And we're currently improving our web presence, so if you look at our website, please look forward to our new website. And then if you have any other questions, please just raise your hand. Sure. We spoke already.
Yes, you did.
Can you tell me who you are and where you're from?
So, Kees Nader I'm Dutch, but I'm living in Brussels, Belgium.
Sure.
I guess we heard a lot of times mentioning the age, so how old we are, etc.
How old you are.
Me
Yeah.
or anybody else.
Sure.
How important is age in terms of how quickly should we get this process going, or can we wait?
It's a very good question. So you're asking specifically, just to reiterate, recapitulate the question, you're asking about male reproductive aging. It's a very interesting question. We never really thought there was something called male reproductive aging. We always thought of it as a female egg phenomenon. And the short answer is we've had intended parents anywhere from the ages of 21 up to 55. And we've seen similar success rates. We haven't seen it in the third party. There are data sets, and Dr. Moskowska could comment on that show some changes when men hit their fourth or fifth decade. We usually thought after 50 there might be some performance issues. But from my experience, the fertilization rate, the embryo development rate is actually very similar, meaning we can have guys that are 22 that aren't getting pregnant, and we have 55-year-olds that are making many embryos. So that story is not complete. I don't think you should feel like a clock is ticking, other than just the emotional piece, like you just want to build your family, you don't want to be in this process too long. That's not a biological comment, it's more of a socio-cultural one, which is that it's not an easy process at the best of times, and our goal is to get rid of you as fast as possible. I mean, to get you pregnant fast. That's why you want to be exiting the clinic. So I think 6 months, a year, 2 months, you shouldn't feel that you're losing time in any way. Performance should not be compromised. And a follow-up to your question would also be the whole role of sperm freezing. Very often I see patients who are starting the process and they feel this incredible urge to freeze their sperm because it's getting older. There's no real form of male fertility preservation that's been documented. We use sperm freezing just for convenience. I've spoken to a few of you about how coming to Canada is not easy, but when you do come, you want to make it as efficient as possible. And so we would want to link up consultation, any of the on the ground items that need to be performed, blood work, and we do recommend freezing sperm for both partners so that it just reduces the number of visits. And it works just as well as fresh. Any other questions? I brought doctors. Yes, sorry, go ahead, yeah.
Is there any difference in the success rate between fresh embryos and frozen embryos?
Excellent question, excellent question. So 10 years ago, I would have said we have a big problem. There was a lot of pressure on using fresh embryos because the technologies used to cryopreserve or freeze embryos was very rudimentary. One of the questions you should always ask any clinic you're going to, whether it's our clinic, is what is the technique that's using to freeze? They should be using a vitrification technique, which is a fast freeze. That's all you need to know. Slow freeze techniques are in some ways easier for some clinics, but result in lower pregnancy rates. We find with our vitrified embryos, that's the fast freeze, the pregnancy rates are pretty much par. Currently, there's actually a debate going on in the whole fertility world about electively freezing embryos, meaning planning for a frozen transfer. So I'm not sure I go that far, but you likely will have a frozen transfer at some point, either for a second baby or for a subsequent attempt. We have not seen in our data significant reductions in rates. I mean, maybe there's 5%, but it has not been clinically significant. And that's actually been replicated in many high-end centers throughout the world. So you may need to freeze even for logistics. Although it's ideal to have your surrogate lined up with your donor, lined up with your schedule, we do have cycles where the donor is ready before the surrogate, and so we end up electively freezing. And I've, in my personal practice, I've never seen a problem.
A PGS, right?
And exactly, as thank you for reminding me. Also, I mentioned a few points the last day about the role of advanced testing, about PGS. PGS is pretty much synonymous with freezing. So almost all of our PGS cycles, probably 95%, are being done as elective freezing. So if you decide to biopsy the embryos to get that extra information on if they're normal or not, you're pretty much signing up for a frozen embryo transfer, which, again, the PGS benefit far outweighs any potential or theoretical benefit, or rather any decline with freezing. And furthermore, the live healthy baby rate, the abnormality rate with frozen versus fresh has not been shown in current studies to be different. So, short answer is it's not unsafe at all. It may even be better. So, unless there's any other questions, I brought Dr. Moscoso, out of the 100 employees, he's like number 111. He's an amazing guy. Not only is he a friend, and is he a colleague, I've known him for many years, also a patient. So I'd like him to share with you one of the best pictures you can show somebody.
So I hope you can see it. So as I said, I've been in your place. I know how it feels and how stressful it is to go through this process. And I think it was very important for me to cross the line, being a medical professional, to be a patient. And it was a kind of an eye-opening experience in terms of how complex it is. Because quite often we see, we can give advice and we look very professional, cool, but when you have to be on that side, it's very emotional. So I can tell you it's really difficult in many different situations. You have to remember you need to have 3 components to succeed. Well, 4, yourself, right? But basically donor, surrogate, and clinic. So we are representing clinics. So what I did, I was shopping for the clinic because there is more than one clinic in Toronto. In Canada, we have 32 clinics. And I think I found the best one. So
Do you think you found the best one?
Yeah, absolutely.
Just checking.
So I not only get my children born in our clinic, I also changed my job. I used to work in different clinic, and I moved. So right now I do work at CReATe Fertility Center for the last 5 years. So what I done with my partner, we had a same egg donor, and we split her eggs in half and half. So we fertilized half eggs with my sperm and half with my partner's sperm, and we implanted 2 embryos, and both of them took, and right now we have 2 daughters. You can probably see they look very different. So my background is Russian, so one child looks very Russian, my partner is Greek. So when they were born, we knew exactly who is who. It doesn't mean that it would be not my biological child or his biological child. They are children, they're twins, but in the meantime, they have sisters, basically, right? It's beautiful, but it's also challenging. I can tell you, I never felt how my age, I always felt like, oh, where is, I can go and think So I'm 47 now, and my partner is 53. So, and I can tell you it's challenging because I don't have the energy. Probably as, we go to playground and all their whatever it is, friends would have parents in their 30s. And I feel like we are a different generation. But in the meantime, I feel that if I could have a chance, I would probably have them a little bit early. We're debating about third child, but I think the main point right now, we do have 14 more frozen blastocysts, so it's not a problem. The problem is, do we have really time and emotional, and physical strength to go ahead through have another child? So when you're thinking about age, I think it's also important. Also remember that 15% of people, men, are infertile. So on your first visit, we'll do extensive testing. And if it's your age is over 40, you had let's say you use recreational drugs quite often, or you have a chronic condition like, I don't know, diabetes, for example, we'll do additional tests to look for your DNA in your sperm. It's called DNA damage. So we will do selective tests based on your background and wherever doctor's recommendations are, and we'll freeze the sample. If sample is good, quite often one sample, one deposit is enough for many IVF cycles, and the reason is that usually one time you produce sperm, we can freeze in several units, and sometimes it's up to 10 units. So basically 1 unit is 1 IVF attempt, because we have quite often confusion between, there's so much information, so right now you quite often feel overwhelmed, and I think you need to do a little homework just to prepare yourself, and if you do have any questions, we'll be happy to address these questions. So before I will go on to tell you, we have those memory sticks, and they have very useful information. So you will find just general information about what we do in our clinic, and as I said, we're very LGBTQ. We use word Q in Canada as well, very friendly. We have a lovely Canadian flag on the back, but also we list everything we do in our clinic. You also find information on PGS, which is pre-implantation genetic screen, basically looking for number of chromosomes inside of the embryo and choosing the best one. You also will find some information on embryoscope. It's a new technology which allows monitoring 24/7 of your embryo and calculates the speed how your embryo develops if it has any abnormalities based on morphology. So we also publish a lot, like Dr. Bratz and myself, we have a professorship at University of Toronto. Actually, all of our doctors are professors at University of Toronto. So we publish a lot, but specifically for your interest, we published, I think it's actually the first study looking for male couples and single men. The reason going through surrogacy, well, we know the reason, but their experience and some examples. So that was published in Reproductive by Medicine Online.
It's actually the largest study in the world.
And also we just published in European journals, Human Reproduction, we publish just overall reasons for surrogacy, and we can tell that probably 1/4 for couples, the reasons because it's either single man or same-sex male couples. We also included, this is just guidelines from government, what is legal, what isn't legal in Canada, in French and in English, so you can find all the information in the sticks. I have some, but we have more upstairs. There's also some contact information for the clinic. It's pride at CReATe.com, and I also have Dr. Bratz's cards as well. So if you do have any questions, please ask me now or later, and welcome. It's challenging, but you can definitely be there.
I was going to say that I am still here tomorrow morning, and what I'm going to do is I'll be in the Hilton Hotel. There's a few presentations I think might help with just Fertility 101 that maybe people are a little shy to ask about, just the basic process. This is not the appropriate venue. But if anyone goes to the Hilton breakfast room area, I'll probably be planning myself there for a couple hours. And if there's a group, I'm happy to sit in the lounge somewhere and just take you through some slides just to show you a bit about like the technology. You might find that interesting. If you don't see me there, I slept in, but I'll probably be there having breakfast. Okay? Thank you. Let's take a stick.